Hello, good afternoon. My name is Dr. Chudi Ufondu of Snowspirations, Global Health Solutions. Thank you and welcome to our clinic, our community health clinic. In next 30 minutes, we are going to talk about the topic for today. Today, we're going to look at the possibility. We're going to look at the facts and fallacies regarding becoming a mother at advanced maternal age. So we're going to look at the facts, we're going to look at the figures, and we're going to debunk some fallacies. So please, when you come in, introduce yourself, tell me where you're located, confirm you can hear me clearly, and if you're joining from YouTube, thank you. Make sure you subscribe. Make sure you use the notification button. If you're joining from our page and our group, thank you so much. If you're my personal friend in Facebook, thank you. And if you're on Instagram, thank you so much. Today's clinic is going to be pretty straightforward. I want to believe if we gather today, we have one mission: to become parents. And guess what? The jury is back. Regardless of how old you are, you can become a mother. You can become a father. So this is what we know. Medically and scientifically, there are certain changes that happen in the body of a woman. When you are a lady, there are certain expectations, there are certain body of knowledge, there are certain realities you have to deal with. But the common denominator remains you can be a mother at any age. Now, for the purpose of medical discussion and for purpose of clarity, when a woman attains up to 35 years and above, she is classified as advanced in maternal age. This classification is based on medical evidence that when a woman gets to 35, it begins to be increasingly difficult for her to become pregnant naturally. So I want you to watch the words I'm using. I never said impossible. I only used difficulties, challenges. And this is because the older you are, the more you have abnormal eggs, the more you have fewer eggs, the more you have what we call reduction in your ovarian reserve test. The ability of you to become a mother naturally is directly related to your ovarian reserve. Your ovarian reserve, it's what is remaining in the quantity and quality of the eggs that God gave you as a girl. So the world of women and men are entirely different. Men come into this world with ability to replace their sperm every about 3 months. You can produce sperm, you can replenish. Per ejaculate, you waste a lot of sperm. That's not the same with the world of women. When you are coming into this world, you are coming in with a complete set of the eggs you will use to start your family. This is not gonna change. And the older you get, the fewer the number and the fewer the quality. So it's expected that the biggest factor that can help you to become pregnant naturally is your age. So age is number one factor. But you can become pregnant above 35. You can have a smooth pregnancy above 35, and you can deliver your baby. So in our group, we are not just interested in helping you to become pregnant. We want you to become pregnant, nurture your pregnancy, and have a smooth delivery. But this is what we know. When you are getting old and when you get to 35, you will begin to experience delays. You will begin to experience challenges. You will begin to experience difficulties. Now, in life, you will experience challenge. You will experience difficulties. Nothing good in life comes easy. So my duty is to remind you that in as much as you can, you have to face your reality. So this is what we know as a fact. If you are age 35 and above, you need to buckle up. You need to step out from your thinking zone. You need to step out from your planning zone, and you need to be in execution zone. So one of the things you need to do at age 35 is to have a fertility specialist who can evaluate your opportunities, who can run fertility tests, who will look at your ovarian reserve, look at AMH, look at your FSH, look at your possibilities, find out why you are having problems, and begin to address your problems. Now, the fallacies, it's fallacious to say that a woman age 35 cannot become a mother. That's not true. You can. You can even become a mother. You can even become pregnant by yourself at age 50. It is possible, but it's highly unlikely, but it's possible. We have seen women that became pregnant at age 50 with their own eggs, but it's very tiny window of opportunity. So it's fallacious to say that a woman, because she's old, cannot become a mother. It's not true. You can, but you need to check the right boxes. You need to deal with your reality. You need to follow due process. You need to do the right things. So what are the right things? Number one, you have to trust God by praying, by changing the way you live in fertility. Number two, you have to acquire the right knowledge. Number three, you have to change your attitude. Number four, you have to change your body of practices and your perception. And you can achieve all this with our PPP method. So practically, if you are age 35, you don't have to wait. You start immediately by employing the services of a fertility specialist, by making love every 48 hours, by exercising, by eating good food, by placing yourself in a better position to get results, knowing fully well that age is not something you can change. You can change your diet, you can lose weight, you can gain weight, you can stop alcohol, but you cannot stop yourself from aging. You might look 16, but your age will tell on you in your reproductive health. So you can become a mother at 35. You can become a mother at age 40. You can become a mother at age 60. Now, if you have the opportunity to have age on your end, that means you are in your 20s. The best time for a woman to complete her family is from about early 20s to about 30s. That's the prime period you have optimal ability to have all your kids. But guess what? Not all of us will see the people who are going to marry by age 20. Not all of us will fall in love. So many people will be in wrong relationship. So many people might not have money. So many people might not have profession. So many people might not have the resources. Guess what? Starting your family requires money. It requires a job. It requires profession. It requires stability. Until you have stability, don't start your family. So in developing countries, what young women do is to delay their ability to age by freezing their eggs. So if you have the resources and you know that until you get to 40 or 50, you are not ready, you can freeze your eggs. If you freeze your eggs at age 20, when you are ready to start having babies at age 40 or 50, your eggs will be 20 years old. You will have a better chance of having a good opportunity of becoming a mother. But when you delay and you get to the stage where you no longer have enough eggs, or where you have gone into what we call primary ovarian failure, or where you have gone into menopause, your ability to become pregnant by yourself will dwindle. Now, if you are not able to achieve this, what are your options? So many options. There are so many ways you can become a mother. There are so many ways you can become a father against all odds. Number one, you can go for fertility treatment. If we identify what is leading to infertility in a male, we can correct that. If you are not producing enough sperm because of obstruction, because of poor quality, if we need to correct that by giving you hormones, we will give you hormones. If we need to operate on you, we operate on you. If you are a woman and you are not ovulating, or you need what we call ovulation induction drugs, We are going to give you specific treatment based on your specific individual need. But the constant is a diagnosis. We have to diagnose if you have primary infertility, secondary infertility, male factor infertility, female factor infertility. When we have a diagnosis, we have solved the problem by 50%. So regardless of your age, you can activate the best option for you. So the biggest tiebreaker in succeeding is action. You have to use the knowledge we share every day to take your bold steps. So let's use examples. If you are 36 in our gathering, and for the past 8 years, you have not been able to have a baby, what do you need? Number one, a fertility specialist. When we refer you to a fertility specialist, you must go for your fertility test. There are standard tests you have to go for. Your partner must also go for the same test. When we have the result of the test, we can determine what the problem is. We can place you on Clomid. We can give you other hormonal treatments if that's your problem. Now, you can also go for IUI, intrauterine insemination. You can go for IVF. You can go for donor X. You can go for donor sperm. Then you can go for surrogacy, or you go for adoption. They are all legal means of becoming a mother. But what is not recommended in our group is inaction. You don't gain anything knowing fully well that your eggs are not there, knowing fully well that your tubes are blocked, and you are wishing against luck, and you are not acting. My sister, you cannot succeed that way if it's confirmed. When you are praying to God, you have to also step up and work on your prayers. So if you want to have twins, you have to do what people that need twins will do. So you cannot achieve having twins at 50 yourself if you don't need a fertility specialist. And thankfully, you have an advantage if you are above 35 to have more than one baby based on the way God structured your body. So a woman at 40 can have triplets, can have quadruplets, can have twins, way much better than a woman in her 20s. Because the older you get, the more likelihood you're going to have multiple pregnancy. So even when you are having 20 years of infertility, you can conquer 20 years of infertility by yielding and going for IVF. One route of IVF, by the grace of God, if it's done properly, you can have quadruplets, you can have triplets, you can have twins, you can have one baby. So your problem is individualized, but it's a problem. Whenever you have problem, you begin to look at solution. So becoming a mother at advanced age, it's possible. With actions, with PPP, we praying, we making love 48 hourly, we seeing a fertility specialist, we eating the right kind of food, we taking your prenatal multivitamins, we watching your body weight, we sleeping, we avoiding stress. There are roles you can play by modifying your lifestyle so you can place yourself in a better place to become. The reason why I'm saying this, I look around our group, I see so many women that are willing, but they are not going the right way. You have to take massive, calculated actions for you to be a mother in 2022, no matter your age. So if you're 80, what do you need? You go and adopt. You will also be called a mother. If you are 70, what do you need? You also go and adopt. You will also be called a mother. If you have the resources, you can adopt twins. You can adopt triplets. You can adopt 4. You are a mother. Your babies are your babies. Your sons are your sons. Your daughters are your daughters. There is absolutely no difference. If you are in your 60, from literature review, the oldest person to conceive naturally and have a twin baby was about age 66. So somehow there are what we call outliers in medical practice. So but your best chance at age 60 to become a mother is to try donor eggs and donor sperm. It can work. In Nigeria, we have registered a 62-year-old lady that became pregnant by going for IVF with donor eggs and donor sperm. So you can go for IVF with donor eggs and donor sperm at age 60, and you can be a mother. But the best option for you at age 60 is surrogacy. You can also adopt. When you get to 50, can you become pregnant naturally? A tiny window. But your best chance at 50 is to go for IVF with donor eggs and possibly donor sperm, and also activate your surrogacy and adoption. When you get to mid-40s, can you become pregnant naturally? Yes, my sister. Though your chances are reduced, but it's possible. But your best chance, if you are going for anything radical, if you want to be a mother at 40, is to consider donor eggs. You have a better outlook if you are in your 40s when you are going for IVF. When you use donor eggs or likely donor sperm, you have a better outcome, because at 40s, you have a reduction in ability to become pregnant. Now, if you're in your 30s, can you become pregnant naturally? Yes, my sister. Yes, my brother. What do you need? You need to increase the regularity and the frequency of your natural lovemaking. You also need to yield to IUI, IVF, or surrogacy if need be, based on your own individual case. So regardless of your age, you can be a mother at any age. So impossible, it's not in our group. God can turn your situation around if you present yourself, if you seek help. This is August. By next week, we will start getting ready to enter September. What are you doing as a mother that has gone into menopause? What are you doing as a mother that has premature ovarian failure? What are you doing as a mother that has been having repeated miscarriages, repeated stillbirth? What are you going to do when your tubes are blocked? What are you going to do when you have oligospermia? What are you going to do when you have azoospermia? What is your practical, evidence-based, fact-based reality check? What do you need to do today to become a mother, to become a father tomorrow? Not just waiting for things that you might not even rely on. Taking charge. Look at your infertility differently, because the overall aim of infertility is to take your joy away. But you were born a mother, you were born a father. What you have is a challenge. It expires. Every infertility ends. The only permanent thing is motherhood and fatherhood. That's your blessed assurance. So you need to organize yourself. You need to look yourself eyeball to eyeball at couples. Have a family meeting. Have a game plan. Budget money. Unfortunately, is expensive. For you to conduct fertility test alone, you need about 100,000 naira. Unfortunately, my people. But here is what I know. Even when you don't have the money, continue your PPP. We have seen so many people that didn't have the money to go for their basic fertility testing, but they were still making love 48 hourly. They were exercising. They were eating good food. They were praying to God. And guess what happened? They became pregnant. So in as much as I might tell you to go and look for money for IUI or IVF or surrogacy, don't stop your lovemaking. At any age, you can become pregnant. Now, listen to me carefully. If you do the right things and if you don't give up, you are going to mount our stage as a mother in 2022. Nobody can stop you. If you do the right things as a family that stick together will overcome any challenge. So make sure you and your partner are on the same page. If infertility management is expensive in your location, if you're in America, in UK, in Canada, in Australia, and it's expensive and you cannot afford it, make arrangements to go to Nigeria. Yes, whatever they can achieve in Nigeria, whatever they can achieve in America, in UK, in Canada, in in Australia. We have selected amazing providers in Nigeria that are doing the same. So what you need is connection. We can connect you. How can we connect you? You need to come in, you need to subscribe. I need to know who you are. I need to look at your case. I need to look at your report. Then I'll refer you. Then you start going to see the fertility specialist who will organize himself and discover what the problem is and begin to attend to you exactly the right way you need to be attended to. Stop comparing your infertility journey with another lady's infertility journey. You guys are not the same, even if you're identical twins. So stop taking some other person's suggestion. Stop taking the clomid because your friends told you they took clomid and you want to take it. No, it's possible that what you are doing is damaging your chance. You need help. Get the right kind of help early. Okay? So that's my presentation. I'm going to open the clinic and I'm going to take your questions. So if you have any question, it's time for open-ended answers. Okay? So please follow Dr. Ndiche. Dr. Ndiche is going to help me to provide feedbacks. Okay? So let's see what we have. And follow my admin. Remember to register for the ovulation bootcamp. Unfortunately, some women are not ovulating. Some women don't even know anything about ovulation. You need to ovulate to become a mother. Without ovulation, no pregnancy, both naturally and with IVF or IUI. You have to get that eggs. There are certain things we can do to help you, okay? Okay, guys, let's talk. Ask me questions, please. It's time for questions. Ask simple, straightforward questions, and I'll give you simple, straightforward answers, okay? The clinic is now open. Okay, so I'm searching for questions. Give me 1 minute. Excuse me. Please, you can ask your questions now, and I'll provide you feedbacks. Hopefully, your questions will be among the ones I can see immediately. Okay, now someone is asking about acupuncture in IVF. There is no direct relationship between your acupuncture and IVF. Some clinics can offer that based on relaxation, but guess what? There is no literature that supports using acupuncture to improve your chances of getting good outcome in IVF. So you can go for it. You don't have anything to lose, but there is no body of evidence to support 100% that when you use acupuncture, you have a better outcome. So you can go for it. You don't have anything to lose, okay? Okay, let's see this one. Good evening. Your cervix is not gone inside. Can it cause infertility? What do you mean by that, my sister? In medical practice, there's a particular condition we call UV prolapse, uterovaginal prolapse. So in some women, the pelvic floor muscle might not be strong enough to sustain and to make sure that the pelvic structures stay in place. In these women, unfortunately, part of the womb will collapse and pass through the cervix and come out from the vagina. Very nasty sight to behold. If that's what you are experiencing, you have UV prolapse, uterovaginal prolapse. You need to see a gynecologist. If need be, there are a couple of things we can do, but ultimately you might need to go for surgery. Your pelvic structures must be in place. So admin, please share the links for Kegel exercise. One of the ways to strengthen your Kegel muscles, your pelvic floor muscles, is to practice Kegel exercise. So if what you are presenting with my sister is what I understand, if you have uterovaginal prolapse, you need to see a gynecologist as soon as possible. This problem is commoner among elderly women. It's not seen among younger women. But if for any reason it's developing in you, you need to go and be attended to professionally. The earlier you go, the better for you. Okay, guys, let's continue. Okay, let me see. Okay, Doc, what can be done for recurring miscarriage even when a sacrilege is done? Unfortunately, my sister, some people have this problem. So what we need, it's a consult with a high-risk pregnancy specialist. So subsequently, all your pregnancies must be planned from the first day of conception. There are some advanced investigations we need to conduct. We take your blood, we take your urine, we check virtually every part of your body to see if we can pinpoint the cause of recurrent miscarriages. When you have lost 3 pregnancies in the past consecutively, about the same sequence, you have what we call recurrent miscarriage or habitual abortion. We have to do the right things and investigate to see if there is anything we can do about it. Unfortunately, most miscarriages are caused by chromosomal abnormality. If the reason why you've been having this series of miscarriages is because of chromosomal abnormality, nobody can do anything about it. But if it's because of hormonal issues, infections, cervical issues, we can do better. We can try our best. So what you need as of this moment is to discontinue trying to become pregnant until you secure the appointment to see a high-risk pregnancy specialist. Unfortunately, in some women, even when we give them cervical sacrilege, they still end up losing the pregnancy. But you are better served consulting a high risk so we can plan your pregnancy, so we can follow you up, so we can support the pregnancy, if need be, give you hormone support, so you can have good outcome. So what you need right now, my sister, stop trying to become pregnant right now. If you continue to become pregnant, the possibility you will continue to lose your baby, it's high and it's painful. Okay, let's continue. All right, let's see. Okay, I've already answered that. Okay, keep asking your questions. Hopefully, I'm going to get your questions and I'll provide you feedbacks. Okay, let's see. Doc, if someone has adenomyosis, what can be done to rectify it? Unfortunately, my sister, adenomyosis is a gynecological condition that must be properly attended to by a trained gynecologist together with a fertility specialist. In adenomyosis, for some reason, the musculature of the cover of your womb is somewhat affected, and when that happens, it can play a role in you not being able to become pregnant. So you need the help of a fertility specialist and a gynecologist. That's what you need. While you're doing this, keep your eyes on your PPP. Okay, let's continue, guys. Okay, someone is asking, how can you meet a high-risk specialist in Ogun State? What I can do for you, if you subscribe, I can send you to my provider in Lagos. My provider in Lagos can refer you to a high-risk pregnancy specialist. I don't have any connection. I don't have any provider in Ogun State. But what I will tell you is this. Follow my admin. Subscribe. You can come in for 2 weeks. You can come in for 1 week, you can come in for 1 month, you can come in for 3 months, you can come in for 6 months. Then I will review and send you to someone that will evaluate you one-on-one, and he can refer you to a high-risk pregnancy specialist in Lagos. So this is what I want you to do. I understand you live in Ogun State, right? Now what you need to do after this, ring your doctor. Ask your doctor if they have any high-risk pregnancy specialist in Ogun State. If they don't have, plan to go to Lagos. It doesn't matter where you travel to get results. Some people travel from America to Nigeria. Some people travel from Canada to Nigeria, from UK to Nigeria, from Saudi Arabia from United Arab Emirates, from Australia to Nigeria to get results. The common denominator is becoming pregnant. When you become pregnant in Nigeria, we are gonna confirm you are okay, and you can go back to America to register for your ANC. It is possible. Don't allow distance stop you from starting your family. Unfortunately, it's expensive. I wish I had the magic wand to make all the women pregnant. But my sister, I run on reality. You need money. So save to start your family. If you need to sell certain things in your home, which are no longer useful, sell them and go and seek help. If you need to downgrade from a very big mansion to few rooms, but you go and start your family, downgrade. Let me tell you my reality. You don't gain anything having all the money, all the wealth in the world, and you die a miserable lady alone. It doesn't make sense. So if God blessed you with the money, with the resources, with friends, with organization that can help you to loan you money to start your family, that will be the biggest investment you can make in your life. But my sister, when we tell people that are mothers and fathers to climb the stage, you cannot deposit excuse. I understand times are hard. I understand that. But there is something called priorities. Prioritize your family. Make starting your family your number one goal. If the only thing you've done in 2021 is to become pregnant and become a mother in 2022, you are the biggest billionaire ever, because your family is permanent. Your baby boys, your baby girls, they are permanent. You will continue your family lineage. So excuses, I understand that. But you ask yourself question, what can I do differently? How can I get solutions? Stop focusing on the problem. Begin to think outside the box. Can my boss loan me money? Can my organization loan me money? What about my brother? What about my sister? What about my friends? This is where you need your social capital. Stop focusing on the Ashebi. Stop focusing on big cars. Stop focusing on big brother. Save and go and start your family. You cannot afford to end 2021 when you know fully well you could have done better. You cannot have millions lying around in your home and you are looking for $1 million to go for IVF. It doesn't make sense, because you will wake up in 2022 and you have gone into menopause. It will be easier for you to go for IVF with your own ex than for you to even come to reality to use another person's egg. And this is possible. So if you are advanced in maternal age, you need to wake up. You are no longer in morning time. You are nearing your evening time. So if you are looking for a black goat, start looking for a black goat in the afternoon, because when you get to night, it will be difficult. This is how the life of a woman is. And there is nothing wrong in getting old. You are gonna overcome. So go for your fertility treatment. Go for your IVF. Go for your IUI. Go for your surrogacy. Adopt. If you have the money, you can do all of them at the same time. It's okay. Thank you for coming. Remember to join Dr. Ndiche tomorrow. Remember to join me later today. I have a topic I will discuss on my YouTube channel. I love you guys, and please remember, nothing is too big for God to do, including fixing your infertility. You can become a mother. You can become a father in the coming 2022. Nothing can stop you from the love of God. Remember that God's aim is to give you an expected good end. So you're going to see your girls, you're going to see your boy, you're going to feel the joy. Nobody can bully you, nobody can challenge you, because you are already going to be a mother. Thank you for coming, and God bless you. And until I see you tomorrow, bye-bye for now.